So Dr. Mehta is the president of the Medical Society of State New York. Um, he's an internist at the New York Presbyterian Brooklyn Methodist Hospital, and he's chief medical information officer there, as well as an associate professor of clinical medicine at Weill Cornell. And he's going to give some updates on what MISNI has been doing over the past few months, as it's always politically active, and especially these days, there's lots of laws and bills that concern healthcare and physicians. So you can take it away, Dr. Mehta.
Thank you so much for invitation, as well as all of you joining on Saturday. Also changing the time, and I see the more is joined also. So Miss Me, we are here for the healthcare of New York. We try to protect the profession and the professional identity. And apart from advocacy, we also do the education and many policies. Mo is going to go over many policies. There are lots of victories. Somehow we don't see those. We usually see the other side, whatever is bothering us. Can you bring my presentation, please? Thank you. So I see that there are a lot of residents and young physicians. I assure you that you have joined the MISNE, and I thank you for that. What we typically do is that we tell you that what MISNE is doing. Today, I'm going to take maybe 5 or 7 minutes to talk to you that you are my future, you are our future, and you are our leader. Next slide, please. Next slide. So there's a slight difference between empathy and compassion. So empathy is required to be leader, and that is good for connection. The difference between empathy, sympathy, and compassion is one is that I feel what you have, I feel with you, versus I'm here to help you. Next slide, please. So what I'm expecting today is completely summarized in this slide, that as you, young physicians, and the future leaders will influence this world a lot. How? By advocacy. For whom? It is for you, your patient, and the world. That is where you need to join and will change the world. We are the lifelong learners, and so you will be. I want you to be a great physician, and that requires empathy. To be a great leader, you need to lead with compassion. And to become a better person, we need to focus on courage over comfort. We need to learn the virtue of gratitude, forgiveness, mindfulness. And we also need to pay attention to the equity and the social determinants of the health. Next slide, please. Being prepared to transform yourself is a requirement for a better world. And that's what I'm asking you, that we will be having a lot of anger. I remember my day. And that is where I have transformed myself from the angry young man to someone who can tolerate a lot of other issues, have perseverance, and get a success. Next slide, please. To do that thing, it's very important that everybody likes to handing out things or funding buildings, because that's tangible. But the real value comes from the systemic change the behavior, and change the mindset. The building you build might stay empty, but the mindset shift keeps impacting the generation. So that's what I'm asking you that today. One message I'm asking you is to change your mindset. Be positive. You will hear a lot of negativity. You are surrounded by the pain and suffering, but there's a lot of good things when you are a physician. Next slide, please. Question is advocacy. We will talk about the advocacy for self. So yes, you should be asking something what is important to you, whether it is your practice, whether it is your money, and we will definitely support. We also have to make sure that the patient comes first and they get it, and more will share a lot more things That's what we have done the good way. Next slide, please. The way in Listening Advocacy was that you bring your idea. You join the Listening, you join the Specialty Society. We all, the Listening represent everyone. Your idea comes to the House as a resolution. That resolution, eventually with the legislative team, will be presented as a bill with the co-sponsor. And once the governor signs, it becomes a law. Mo will be telling you many of these bills, resolutions, and how it has converted and how it has helped us to shape many things in not only New York, but even at the AMA level. Next slide, please. How can an individual influence for the positive change? Next slide, please. This is the only word, another message I want to give you, that when you look with the courage at the world and around yourself, remember, world is not perfect. If you understand the world is not perfect, you will understand to make it little better, and that is more important. Next slide, please. Once you look with the courage, you need to have the vision, and that is the envision with the rigor. What it happens is envision that the leader and the subject matter expert collaborate. You get the expert to give you the advice, and then you implement that. That's how the changes happen. Next slide, please. Once you have courage and envision, you are going to build with excellence, and that requires the feedback. So there should be a rapid loop, and you believe in all of that. Next slide, please. So there are 4 key actions: fostering the understanding and conviction, reinforcing change through the formal mechanisms, developing talent and skills, and modeling the new role. Next slide, please. Can I do it? That's the biggest question. As a young physician, you may think that it is not possible, it's impossible. I'll just tell you the short story of the 4 presidents. Next slide, please. These are the 4 presidents we'll be talking about. They have gone through a lot, and still they have been very well known to all of us. Next slide, please. So what happened with Abraham Lincoln? He was born to an illiterate father. His house has no doors, no floor. He was poor, did not have any proper education. So what happens when he enters the adulthood? He was nobody. Next slide, please. When you look at the Teddy Roosevelt, his grandfather was the richest person. His father was well known. He has everything at his service: the library, teaching, education. And when he entered adulthood, he's well known. Next slide, please. If you look at the temperament, Franklin Roosevelt, FDR, growing up in a loving planet, warm, stable, and peaceful and nurturing home. And Lincoln, he was melancholic. He was shaggy. And at the same time, he does have ambition, but nobody believes that he can reach to that level. Next slide. When it comes to the health, Lincoln was strong, tall, and was doing a lot of labor. But he didn't have the mental problem. While Teddy Roosevelt had significant problem, that is the asthma, he cannot do anything, cannot go out and has to stay in house. Next slide, please. Memory. Lincoln has extremely poor memory. Could not remember. He has to rewrite and write and read and read. Roosevelt, in contrast, has a photographic memory. Next slide, please. Depression. Lincoln was so depressed that people were afraid that he will commit suicide and they will remove the blade or any of it. Teddy Roosevelt, he lost his mother and his wife on one single day at age 25 and was extremely depressed. And the same thing about Johnson, that he had a severe heart attack and he couldn't do it. He was also depressed. Next slide, please. So that's where it comes to that. Was any of this president a superhuman? No. These presidents were definitely gifted, but they were still human. And they have strengths, but they have significant weaknesses also. And they were just like one of us. Next slide, please. So what happened to these presidents? Why they become what they become? is simple one word, that they had ambition. So when the adversity arrives, it is combined with the ambition. They did well. Next slide, please. This is the message, the third message after the first two, is that what happened to all this crisis is one thing in the common, that they have to recover. They have to reflect and rebuild. Basically, they have to pull out of all the politics. Think about it, come back and conquer. So that is what the one message for all of us, that respond, reflect, recover, and rebuild. Maybe yesterday or last week, you had a problem and you want to respond to that. You have to reflect upon it. You recover and rebuild. Why I'm saying this? Because our battle against the tort reform, our battle against the scope of practice is never going away. Our battle against CMS, cutting our rates every single year, will be different. You all and we all need to find a new way, reflect on what we have. We need to recover and we need to rebuild this society, New York, and everything else. Next slide, please. Keep clicking. It will be bringing all the things. So to be a good leader, you need to have ambition and adversity together. Empathy and compassion. So you connect with empathy, you lead with compassion. You respond, reflect, recover, and rebuild. Next slide. You look back with courage, you envision with rigor, and you build with excellence. Be a better leader, lifelong learner, and be a better human. And that's all what I'll say at this moment. I'll pass it on to Mo because he is the expert. I really want to say thank you to Mo and his entire team for many, many recipes which he's going to share. At the same time, we are going to face one big challenge, and that is for the wrongful death. And I encourage all of you to ask everyone, whichever you know, your father, mother, brother, sister, to write letter to the governor that the wrongful death is wrong for New York. Thank you.